Warm welcome to our webinar on scope of pharmacy practice in Australia. Myself, Rekha Anubrolu. I am admin manager of Elite Expertise. Coming to my profile, I have done my graduation in Bachelor of Pharmacy in the year 2016 from Karnataka, India. And then I have done my master's in public health from Australia. I'm also one of the KAPS qualified candidate. I cleared my KAPS in March 2023 under the guidance of our directors, Mr. Arief Mohammed and Mrs. Harika Bhimavarpu. Not just me, there are more than 500 students who cleared their KAPS exam under both Sir and Ma'am's guidance in their first attempt. So I also received my 190 permanent residency visa to Australia. I'm looking forward to start my pharmacist career in Australia very soon. Let me introduce Elite Expertise, what we are, what are the courses we offer, and everything. Elite Expertise, we are an online education platform founded by Mrs. Harika Bhimavarpu and Mr. Arief Mohammed, with a mission to deliver quality education as well as practice-based knowledge to all those aspirants who are willing to migrate to Australia and start their pharmacist career there. So our courses range from KAPS, knowledge assessment of pharmaceutical sciences, intern written exam, intern pharmacist oral exam. So these exams enable overseas pharmacists to migrate and register as a pharmacist in Australia. So along with this, in future, we are also planning to launch pharmacist licensing exams for other countries like Canada, USA, UK, Ireland, and so on. So now I would like to introduce one of our director, Mrs. Harika Bhimavarpu, one of my favorite. She's the director as well as the educator at Elite Expertise. Uh, Harika ma'am did her Bachelor of Pharmacy as well as Master of Pharmacy from India, and she migrated to Australia in the year 2018 by successfully clearing KAPS exam. She started her career as an intern pharmacist in community sector. She have been practicing in Australia from 6 years and has mastered in various clinical skills. She's a proud mother of 2-year-old, but she never left her passion for pharmacy practice as well as teaching. Her hardworking nature, her kindness always inspires me. She's one of my inspiration. Not just this, she's also an accredited consultant pharmacist and a member of Society of Hospital Pharmacists in Australia. Currently, she's working as a clinical pharmacist and clinical pharmacist educator at Monash Teaching Hospital. It is one of the top hospital and research center in Australia. Monash Health is also one of the largest public health services in Melbourne, Australia. Harika ma'am has an impeccable track record in training students for KAPS exam over years, and she have helped more than 500 students in clearing the KAPS exam in the first attempt. So I would like to welcome Mrs. Harika Bhimavarpu, our director and educator at Elite Expertise. Welcome, ma'am.
Hi, Rekha. Thank you so much for a good introduction. Thank you. Thank you for compiling everything for me. So let's start the session. As Rekha said, I'm Harika Bhimavarpu, one of the directors and educators working for, directors of Elite Expertise. So I've moved to Australia in the year of 2018. I've graduated in 2013 and then finished my master's in India, a 2-year master degree. Then I decided to move to Australia. So in 2018-19, the years I've started working as an intern pharmacist after clearing my KAPS exam. In a community pharmacy, in a community setting called Moama Village Pharmacy in the New South Wales. And then my background in India was hospital pharmacy, and I always had a passion for clinical pharmacy career and to explore and enrich my knowledge in Australian pharmacy practice and to serve patients in the community. So that made me move to hospital practice, seek for more opportunities, search for the greener pastures. And I started working for Regional Victorian Hospital. Then I moved recently to Melbourne, where I work for Monash Health as a clinical pharmacist educator. Unlike where pharmacies are profit driven, Australia boasts of being like pharmacists in Australia boasts of being the irreplaceable healthcare professionals in our community, where they can prevent medication mismanagements and save the life of the patients through referrals, constant upgradation of their knowledge and practice from time to time. We don't get rewarded for selling medications, but we get rewarded for not selling medications. That means we get rewarded for stopping any drug-drug interactions. We get rewarded for choosing the best therapy to be helpful for the patient and their well-being, to suggest a good remedy or to suggest a good therapeutic management. And we always act in liaison with the general practitioners. If you're working in a community pharmacy where GPs work going hand in hand with you and always are ready and keen to explore the additional options which might benefit the patient always, rather than just focusing on the conventional treatment regimes. Apart from that, Australian pharmacy practice has expanded its scope well above and beyond the normal practice of just dispensing medications to very vast areas of accredited consultant pharmacists, which I'm one of the accredited pharmacists. And we've done diabetes checks, diabetes meds check, asthma education. Like we've had a recent webinar last time by Shuri Baden, who is one of the asthma educators in Australia. So with her respiratory talk, which was really very informative, if you would like to go and refer to it. And apart from that, we have extended our scope to prescribing, like, basic antibiotics, S3 medications, Schedule 3 medications, and then referring to the general practitioner at the first go. Because when a patient has a problem, like we are the first person whom they walk into, and they don't have any restriction. Our doors are always open in a community pharmacy where they walk in and talk to us about their problems, their concerns, and their issues. And depending on if you have if they want you to, if you decide to refer them to a general practitioner for best option to treat the disease or ailment or the problem in the first go itself, rather than wait and delay. Because the best intervention is done as soon as you predict something is wrong, rather than waiting for the correct diagnosis. That referral is done by a pharmacist, and I'm very proud to be one of the pharmacists practicing in Australia. So community practice is rewarding in itself. And in today's webinar, we have a community pharmacist, Ross, and we have hospital pharmacist Arief Mohammed, who is one of the directors and educators at Elite Expertise. So working at Northern Health Hospital in Melbourne. So Ross would cover the community domain, and Arief Mohammed would cover the hospital domain, and bring you to the, give you the taste of Australian pharmacy practice, how we practice here, and how rewarding our career is, and how satisfaction, how we get that professional satisfaction when we practice here, and really be able to help change patients' life, help them have a good lifestyle, healthy lifestyle, managing their disease in an effective way, and leading a happy life. So today, our chief guest of honor is Mr. Ross Rue, our honorable guest speaker, who has been very kind in accepting our request for the webinar on scope of pharmacy practice in Australia. So I was very lucky to work with him in a community pharmacy in regional Victoria, which was a very friendly, family-like place. And Ross really gave me that support and guidance. And he was always there to help me when I had questions in the practice. And he was the pharmacist in charge when I was working with him, and I was helping him the community practice. So we had a very good memorable event, memories together, working together. So Ross Rue is a senior community pharmacist who's finished Bachelor of Pharmacy from the Latrobe University Bendigo in the year of 2005. And then he has finished his internship in the year of 2007. From then he started practicing as a registered pharmacist in Australia. He worked in community pharmacy in different locations in Australia, primarily in Victoria. That's where I met him and worked with him. I'm glad he's here. And he's also worked over years in the Torres Strait and Northern Peninsula area in the far North Queensland, and he's got impeccable record of serving Australian community, and helping them health-wise, helping to get the best outcomes from their health and well-being. So I'm very, very happy to introduce Rose. And hello, Rose, are you there?
Yes, hi.
1 second, I'll just figure out. Sorry, Rose, how are you?
Good, yes.
We welcome you. I can't see you actually. Is your video on?
Yes, I think, okay, there we go. That's got it.
Yeah. I think a bit of adjustment is required. We can't really see you fully.
Right.
Oh, you're
Okay.
in your attire, I think. You working today?
No, well, not in pharmacy, but yeah.
Yeah, kind of working for the, yeah. So we would love to hear from you, like, the scope of pharmacy practice and, like, throwing the light on the community practice where you have that expertise and knowledge and years of experience. So I'll over this to you, and we have got audience waiting. So yeah, go on.
Okay, cool. Yeah, so pharmacists, we're sort of the experts in medicines, and we have a professional responsibility to ensure the quality use of medicines, that ensuring that medicines are used safely, effectively, and judiciously. So we sort of need to make sure that the right patient is getting the right medication at the right time, and not just that they're getting the right medication, but they have the right information to know how to use the medication and how to manage their health conditions. So as Rika mentioned, community pharmacies are often people's first port of call for any medical queries and things. So we're sort of the most frequently accessed and most accessible health destination for people in the community. Often people will come into us, and want to know, this is my issue. I wasn't sure if I'd be able to get in to see a doctor. Do I need to see a doctor? Can you help me? So there's often a bit of triaging we do in that respect, to give people the information that we can, but also refer people to the appropriate other health professionals, whether it be optometrists in some instances, often GPs. Sometimes it is directing people up to the emergency department at hospitals to get that urgent care that they need. So yeah, it's nice to sort of be that point in the community where people go for help and advice, and be able to sort of direct them. And when we can't actively do things ourselves for them, we can able to direct them on to the services that they need. We're probably the most accessible healthcare professional in Australia, which is pretty handy. It's sort of, there's a lot of variety in what we see every day in community pharmacy, which is really good. It sort of makes it quite interesting and quite different each day. There's a lot of research on the scope of community pharmacy. There's been research that's found that 88% of Australians support the idea of community pharmacists being able to provide more health services to their patients, provided they're trained and follow professional standards and guidelines. That's sort of expanded a lot over the years, from the provision of vaccinations to many services we can get into. There's a lot of people who've responded as well that they'd be comfortable with pharmacists monitoring their cholesterol levels and renewing relevant prescriptions for those. Many of, like 81%, with the idea of.
I think your voice is a bit breaking.
Oh,
yeah.
Sorry. So in this recent study, 81% of people were comfortable with the idea of receiving assessments and administration from pharmacists for travel vaccinations, and that's one of the new aspects of professional services that we can provide within Victoria. Other states as well. I'm more speaking from a Victorian perspective because that's where I'm working currently. So it's a broad role that we have in pharmacy, and always expanding. Part of it as well is that we need to undergo continued professional development. So the competency of pharmacists in Australia, we need to do a minimum amount of continued professional development over the course of the year. A big part of that is creating a plan for what sort of topics and things we'd like to study and where we'd like to improve our knowledge to be able to provide the best to our patients. Yeah, there are so many services that we provide in pharmacy. Vaccination is a big one. Over the years, it's gone from pharmacists providing the influenza vaccination seasonally to we were quite probably during COVID, we were one of the major vaccination points for people because community pharmacies were quite well distributed in Australia. There are a lot of community pharmacies around, so we were a significant point of access for people to be vaccinated. Wound management is something that we often do. People come in to see us. Many times their wounds are minor things that we can dress and provide that service to them. Sometimes obviously they prefer, but where it can be that first port of call for people. During COVID in particular, telehealth services became a big part of things. A lot of community pharmacies, we provide delivery services, so people will order their medications and we'll deliver them to them. They mightn't be able to get up the street and things like that, so offering that service to people is really handy, and being able to call people, go through the new medications or answer any questions is a pretty vital role that we have. A lot of community pharmacies provide services for sleep apnea, CPAP machines, APAP machines, sleep studies, all manner of things with that. Rightio, so the scope of community pharmacists' role in Australia, we are the experts in medicines, so we have a professional responsibility to ensure the quality use of medicines. So we ensure that medicines are used safely, effectively, and judiciously. We have to ensure basically that the right patient is getting the right medication at the right time and with the right knowledge. So we, not just providing the medication to people, we're providing that knowledge and on how to use medication and how to manage their health conditions. Community pharmacies are the most frequently accessed and most accessible health destination in Australia. So often pharmacists are the most visited and accessible healthcare professional in Australia. In a lot of ways, we act as a community's first contact when they're trying to seek advice on their health. Often people come to us with all manner of different ailments or questions and queries. We can provide a lot of advice and we can provide a lot of medications and things. Sometimes we do have to refer people on when that's appropriate, but it keeps things very varied. There's a lot of different questions that we get throughout the day and week in community pharmacy. The Pharmacy Guild of Australia has done a lot of research recently. A lot of pharmacy groups in Australia have done a lot of research into the scope of community pharmacy in Australia. The recent Guild report was great because it actually was able to show how much support the community had for the idea. The Pharmacy Guild commissioned some studies recently, which were really good because they were able to just answer some of those basic questions about how much support there was in the community for community pharmacists being able to provide more health services to patients, provided that we do appropriate training and follow standards and guidelines. So 77% of respondents were comfortable with the idea of pharmacists monitoring their cholesterol levels and renewing relevant medications. 81% were comfortable receiving an assessment, administration, and the supply of travel vaccinations or preventative medicines. There's a large-scale program in Victoria at the moment where community pharmacies can provide a lot of travel vaccines and medications, provided that the pharmacy registers for it and that the pharmacists do the particular training program. There's a really good methodology attached to that. So it's not just it's an example of pharmacy being able to improve the scope of our practice in a measured and meaningful way that the community appreciates. So it's not like we're just trying to do different things. We're actually doing more things for the community and in a way that helps benefit the community quite significantly. As I mentioned, we need to do studies to provide these services appropriately. Practicing as a pharmacist in Australia, it's important that we do a continuing professional development over the course of the year. It's a requirement that every pharmacist does a minimum amount of CPD throughout the year. Part of that is planning the CPD that we'll do to try and work out what knowledge we'd like to get and what services we'd like to provide. So doing a bit of work as to how we can best deliver those services to people. So some of the services provided by community pharmacies are vaccination. It's gone from just being things like the seasonal influenza vaccinations, which community pharmacies did a lot of, but also during COVID, we were one of the major providers of the vaccinations for COVID in Australia because there's such a broad network of community pharmacies and where we can often be a bit more accessible, then sometimes it can be difficult to get into a medical general practice to see a doctor for vaccinations, whereas pharmacies just are another sometimes more accessible for patients, which is really good. Mood management is another service that we often do a lot of. People come in to us before going to a doctor or seeing a nurse or going into hospital, and oftentimes we can provide them the right advice and dressings and experience to sort of look after their wounds. We obviously refer when it's appropriate to do so. Telehealth services is a big part of community pharmacy as well. We often provide a lot of advice over the phone to people, and it's a really good avenue of being able to provide advice and help to patients who might not necessarily be able to make it into the pharmacy for various reasons. Sleep apnea. A lot of community pharmacies provide support for people with sleep apnea, whether it be CPAP machines, APAP machines, fittings for masks, even facilitating sleep studies for patients to try and assess what level of sleep apnea they have, what sort of machine and settings would be most appropriate for them. That can be a really interesting aspect or a service for pharmacy to provide. We provide a lot of support for people to quit smoking. We also opioid dependence treatments, opioid replacement therapy. Community pharmacies can be significantly involved in that. Again, because we're such an accessible part of the community, people can, if pharmacies do the relevant training and set up their service appropriately, they can actually provide treatments for people with their opioid dependence with them being prescribed by doctors and things, but we provide the actual dosing and supervision of dosing and looking after the patients in a lot of ways, which can be really really positive thing for the community, and it can be a really rewarding feeling to be helping people. Diabetes med checks are something that Rika mentioned. A great service to offer people, particularly type 2 diabetics who are often on a whole range of oral hypoglycemic agents. Yeah, so diabetes med checks can be quite a rewarding thing for patients, in particular type 2 diabetic patients, because they can often get so overwhelmed when they have such a complex regimen of medications and things. So being able to sort of take the time to one-on-one sit with these patients, go through their medications with them, provide additional advice and help them sort of rationalize the medications they're on, how they're using them, how they're managing their condition. That can be a really great example of the quality or the the way we can improve the quality use of medications for people and improve their general well-being and health, and how engaged they are with their looking after their own health as well, which is related to diabetes management. Pharmacists in Australia are one of the few health professions that can actually do some further education, become credentialed diabetes educators, which is another avenue of study and service provision that pharmacists can do in Australia. I won't get into that because it's a whole other topic, but it can be quite rewarding as well. Medication compounding, we can provide a lot of, or community pharmacies can provide a lot of compounding. Even without being a specialised compounding pharmacy, we can often compound simple things, whether it be creams and ointments and things, sometimes mixtures. We can provide some basic mixtures, provided we follow the guidelines and legislation regarding how we provide those services. But that can be another really interesting aspect of pharmacy too. Blood pressure monitoring, it can actually be a lifesaver for patients. You do sometimes have people come in feeling a little bit off. They want their blood pressure checked. They didn't want to go to the doctor, didn't think it was worth going to hospital or anything like that. But when you check their blood pressure and it is as high as it's reading, you encourage them, you get them to hospital. In some cases, you sometimes even have to arrange an ambulance or transport for the patient to get to hospital, so that their acute critical situation can be handled quickly and effectively. Cholesterol testing, as mentioned, is something that pharmacies can provide, and there are programs available where pharmacists can provide additional prescriptions for patients who are on their cholesterol medications to try and manage that issue when they might not be able to get into their doctor as regularly. Bowel cancer screening, we are a point of contact for that. We can sort of sell patients those, provide them with advice. They can submit the samples off for screening tests and things. Asthma management is a big one. Insulin, the short-acting beta agonists, being a Schedule 3 medication, which is a pharmacist-only medication, means that as pharmacists we can, when it's appropriate, provide those medications to patients. Can help them manage their asthma more broadly as well, make sure they're on the right combination of medications, they understand how to use their medications and how to get the best out of the medications to get the best out of their life. Likewise for COPD. Weight management, a number of community pharmacies will have within the pharmacy weight management programs and things that we can like meal replacements, things like that. Also, there are some Schedule 3 medications to help people with obesity, which can be quite interesting as well. Dose administration aids, the provision of packed medication or packing patients' medications to make the day-to-day management of their medication more easy, is a big aspect of pharmacy. Arranging the packing, checking and making sure everything is correct, giving the advice to patients, that can streamline people's medication regimens significantly to make it a lot easier for them day to day. Meds checks, like the diabetes meds check, but much broader. We look at the entirety of a patient's medications, get them to bring everything in, sit and go through with them, check how they're taking their medications, how they think they're meant to be taking their medications, look at how the doctor thinks they're taking their medications or think they should be taking their medications, and provide advice about all of the medications, work out what can be done to sort of improve things and improve the patient's health. Mental health support, being that we are one of the most accessible health professions, often people who come into us, like they haven't been able to haven't been able to get they might be new to some medications, and it's easier for them to come back to the pharmacist and ask for it. So we tying it back into the idea that we are one of the most accessible health professionals. Often people can come into pharmacy when they're not able to get into a doctor or a counsellor, when they've started on a new medication or changed medications. They want that advice that is this a issue with the medication they're having? Is it a issue with their mental health that they're having? We can provide that advice and support to people and help linking them up to the right services that they might need if there's additional help that they can get or additional help that they might need. Now, yes, in terms of accredited consultant pharmacists, they are able to provide home medication management reviews and residential medication management reviews. Those are a process where a medical practitioner will refer or the GP will refer people to an accredited pharmacist to sort of in more detail than just the meds checks, to go through absolutely everything with their health and medication. And the accredited pharmacist can sort of prepare a more solid report back to the referrer or the general practitioner patient to adjust their medications, identify any potential interactions or any issues that are impacting how the patient might be using their medications or the medication regimen that the patient might be on. Does robotic dispensing replace the pharmacist? No, absolutely not. I've been working in pharmacies that have had robots on and off for over 10 years now, and they have made aspects of my life a lot easier, but they definitely have never made me feel like we're at risk of the robots taking our jobs.
Yeah, very true, very true. So robots are just to help us, they can't replace us.
No, definitely.
Yeah. Go on, sorry.
So yes, prescribing pharmacists in Australia, that's a really new aspect to things. A few of the states have done pilot programs and studies, and there are standards and accreditation for pharmacists in order to be able to prescribe medications to people for particular conditions and in particular situations. There's a really good so the board's come up with a decision as to developing set accreditation standards for pharmacy prescribing education programs, which provide a framework for pharmacists to be able to prescribe in accordance with the authorizations that the states and territories are allowing for, and just to ensure that we're providing an appropriate level of care and the best advice and service that we can to people. The Australian Pharmacy Council is developing the standards on behalf of the board, and they have started the consultation process. First round has closed, and we are hoping that the second round of consultation will be later this year. Later. But yeah, the APC's website has a lot of information about the consultation process. In Victoria, there's a broad pilot program running currently where with pharmacies, a pharmacy has to express their interest, and then the pharmacists within that pharmacy have to do one of these education programs, and we can prescribe medications for things like simple UTIs, contraceptives, also travel vaccination is another big component to that as well. Within Victoria, other states have done programs on similar things and are doing additional ones or different ones as well. But yeah, definitely worth looking at the Australian Pharmacy Council website And that gives a bit of information about some of the education programs available.
I think Queensland also has it, isn't it? Queensland prescribing. Yeah, I think it started first, and then we moved to Victoria. Yeah.
Yeah. Queensland, they had quite a large one on UTIs, and that got some really good results. And yeah, in Victoria, they've sort of been able to use a lot of their framework from that and apply that here as well, which is great. Yeah.
Yeah. Thank you. Thank you, Ross. If anyone has any questions, they can pop in a message on chat. I'll filter the right questions for Ross. So what qualities would you expect in an intern pharmacist?
I think being willing to learn is the big one. Being willing to sort of accept some of the day-to-day challenges and things and just get out there and deal with patients is a big part of it. Gradually building more experience with that. But yeah, that's probably some of the biggest things I would say.
Yeah, true. Being open to learning all the time and trying their best to reach perfection is what we expect.
Definitely.
Yeah, I think it's pretty much it. The other questions I can answer later. Thank you so much for your precious time. Thank you so much, Ross. Thank you once again. So nice to have you here with us.
No worries.
For community practice and scope in Australia. Thank you so much.
No worries. Thank you very much. Appreciate it.
Okay, guys, that was a talk by Mr. Ross Rue, a community pharmacist in Australia. We'll have a talk by hospital pharmacist, Mr. Arief Mohammed, who is one of the directors of Elite Expertise, working for Northern Health Hospital in Melbourne. I'll over it to Rekha. Rekha?
Yes, ma'am. Thank you.
Like to continue handling everything. Thank you so much.
Sure.
See you.
See you, ma'am.
And I'm sorry, guys, for any toddler voices. My toddler is just coming in and going and peeping things. So thank you so much. And over to Rekha. See you.
See you, ma'am. So I hope you all had an informative session regarding scope of pharmacy practice, community pharmacy practice in Australia. Thank you, Mr. Ross, for sharing your insights. So now let me introduce one of our directors and educators, Mr. Arief Mohammed. He's an ocean of knowledge. He's also, as I said, director as well as educator of Elite Expertise. Arief sir did his graduation in Bachelor of Pharmacy and post-graduation in Master of Hospital and Clinical Pharmacy from India. After that, he worked as a lecturer in Malaysia for 3 years and then migrated to Australia in 2017 by successfully clearing his KAPS exam. Since then, he have been practicing as a pharmacist in Australia and gained experience in both community as well as hospital sector. So Arief sir started his journey as an intern in community sector, and as soon as he finished his internship, he started his journey as a clinical pharmacist in the hospitals. So right now he's working as a hospital pharmacist, a clinical pharmacist in Northern Hospital. It's a well-known healthcare provider in Australia. Along with this, he's also an accredited consultant pharmacist, member of Pharmacist Immunizer in Australia, and a member of Society of Hospital Pharmacists in Australia. Arief sir has established his teaching career of training more than 500 KAPS students. So all of them passed, most of them passed in their first attempt. And he's also a seasoned professional with an immense experience in hospital and clinical pharmacy practice. Arief sir has played a pivotal role in advancing pharmaceutical care as well as patient outcome within the healthcare system. So now I would invite Mr. Arief Mohammed to give insights on scope of clinical and hospital pharmacy in Australia.
Thank you so much, Rekha. Thanks a lot. Okay. And first of all, I would like to thank our guest, Mr. Ross, who is a well-experienced community pharmacist. So I'm thankful so much, Ross, for sharing your knowledge with us. Okay. So guys, first of all, good evening to everyone. And today I'm here to share like what are the scope of hospital pharmacist here in Australia. So already you might have gone through all the things that Mr. Ross has spoke to you regarding the community pharmacy practice. Okay, so now I just want to share how the hospital pharmacy practice it will be and what scopes that we can have as a hospital pharmacist here in Australia. Okay, so for that, at first, I would like to share my slide with you guys. I hope everyone can see this slide.
Yes, sir, it's visible.
Okay, thank you so much. Okay, guys, so myself, Arief Mohammed, I'm one of the directors and lecturers at Elite Expertise. And currently I'm working as a clinical pharmacist in Northern Health Hospital in Melbourne. And also I'm a consultant pharmacist here in Australia. So today I'm going to explain you what are the scopes of hospital pharmacists, like what opportunities that we can have in the hospital sector. Okay, so in the hospital pharmacist, in the sense, most of the times that we think about the clinical practice role. Okay, and most of you will have the passion of working as a clinical pharmacist in Australia. Okay, so especially those who have done their PharmD in India or in Pakistan or in any countries, they have a lot of passion to work as a clinical pharmacist. So I can say that it is not only the PharmD candidates, but also the Bachelor of Pharmacy and those who have done the Masters in the pharmacology and so on. All they have the passion to work as a clinical pharmacist in overseas. Okay. So I can say that Australia is one of the countries which have got a very good opportunities for all the pharmacists, especially those who have the passion to work in the hospital sectors as a clinical pharmacist. So now I'm going to share you what different types of the specialities that we have here in Australian pharmacy practice. Okay. So first of all, the most important thing is the main body that is essential for the hospital pharmacist is the SHPA. So SHPA stands for the Society of Hospital Pharmacists in Australia. So it is a common body where all the pharmacists, especially the hospital pharmacists, like more than 5,000 plus hospital pharmacists are the members of the SHPA. So SHPA conducts a lot of webinars as well as the workshops and a lot of other resources. It provides a lot of other resources and the CPD training programs for the pharmacist. So it is one of the main bodies through which all the hospital pharmacists, they become a member in it. Whereas for community pharmacists, we got other two options. One is the Pharmacy Guild of Australia, and the other one is the Pharmaceutical Society of Australia. That is the PSA. Okay, so PSA and Pharmacy Guild, they provide a good, like a vast source of information for community pharmacists. But especially for a hospital pharmacist, it is the SHPA, which provides a lot of training as well as workshops and the webinars and so on for hospital pharmacists. Okay, and as I mentioned, that most of the hospital pharmacists, they will be one of the members of SHPA. Okay, so SHPA recently in the sense, like for the last 6 to 7 years, the practice in Australia has been completely changed now. Okay, so earlier, like 10 years, 15 years back, the practice was everything it used to be normal practice, but now the practice is completely changed. Like the practice is more specialized one. Okay, so specialized one in the sense, nowadays there is a specialized practice in hospitals, like specialized pharmacist in cardiology, specialized pharmacist in neurology, specialized pharmacist in infectious disease, and so on. Okay, so now let's have a look through about all these specializations, and let's see what are the main advantages, and there are some drawbacks. There are not, I can't say that there are any drawbacks, but most of the specialities, they have got a good advantages, and it again depends on the interest of the candidates. Okay, so interest of the pharmacist in which specialization they want to practice. Okay, so I'm going to share these slides, guys. So the first one is the specialty of the cardiology. So it is one of my interesting topics. Okay, so I have a very passion in cardiovascular system, and since my Bachelor of Pharmacy, I was very much interested in cardiovascular system, and the same thing even in my master's, I did a research in cardio in the CVS, and then after that, even after coming to Australia, in the hospitals, I worked in as a cardiology pharmacist. Okay. So cardiology pharmacist, in the sense here, the pharmacists, they work in the coronary care, cardiac units, emergency department, critical care, cardiac rehab, and cardiac surgery, and so on. Okay. So they have a very good role here in the hospitals. Okay. So especially whenever the patients, they get admitted in the hospitals, it is the responsibility of the cardiac pharmacist. Let's say, for instance, the best example that I can give to you is the role of digoxin. So digoxin, when they start the patient on the loading dose, okay, so loading dose of the digoxin is mainly given in case of cardiac arrhythmias. So we won't give loading dose in case of heart failure conditions. So we give a high loading dose only in cardiac arrhythmias. So once the doctors, they start the patient on the loading dose of digoxin, then immediately it is the pharmacist's responsibility to monitor it. Okay, it is the pharmacist's responsibility to check how long the patient should be on the loading dose. Ideally, the patient should be on the loading dose only for 24 hours. Like the high dose of digoxin, 250 micrograms BD dosing, okay, the patient should be only on for 24 hours. So it's the pharmacist's responsibility. Immediately, the pharmacist will put a cross checks up over there. Okay, so in Australian hospital practice, the pharmacist will have the complete rights. Okay, they have the complete rights to seize the medication, to ask the doctors to immediately stop the medication. Okay, so they will be given the full rights to practice. Okay, like whatever the things that we study, okay, that we can practice in hospitals in Australia. Okay, so it is one of the interesting specialty, I can say. But again, there is a small drawback with this cardiology specialty. The drawback is, like all the hospitals, they won't have the cardiology specialty pharmacist role. Okay, so only few big hospitals, they will have the cardiac specialty. So only those hospitals will offer this role. It means that in case if you are interested in cardiology, to become a cardiology pharmacist, and you have done all the credentials and you have become a specialized cardiology pharmacist, okay, but in case if you want to work in one of the rural areas, in rural hospitals, okay, so the rural hospitals, you won't find the scope to work as a cardiology pharmacist. Okay, so you need to find one of the hospitals in cities, okay, like in the big hospitals. Even in the big corporate hospitals, like the problem is, by the time when you are searching for the job, you might not get this position, the cardiology pharmacist position. Okay, so that's the drawback of the cardiology specialty. Okay, but it is one of the interesting specialties, okay, where we can learn a lot about all the medications that we use in the cardiac system. And also in our classes, we have seen a lot of medications. Okay, the main medications that we cover are the cardiovascular system drugs, okay, cardiac drugs and the neurological drugs. These two are the main drugs that we cover. Okay, so that's about the cardiology. And then the second one is the critical care specialization. So critical care specialization is nothing but where we get specialized in ICU, or we can become an ICU pharmacist, or in the emergency medicine. Okay, so it is also one of the challenging roles. I can say that it is a challenging roles. Okay, and it will have a very good scope, especially if you want to practice as a emergency medicine pharmacist or in the ICU, that is in the critical care, then you will have a very good scope. But provided that, again, this role, you can find the jobs not only in the big hospitals, like in Melbourne, Sydney, but also in some other towns as well. You can find the scope to practice in the critical care. Okay, because most of the hospitals, they will also have, along with the emergency department, they will also have the attached ICU facility. Okay, so it means that the scope will be more in case if you become a critical care specialized pharmacist. Okay, then moving on to the next scope that Australian hospital that is the Australian hospitals, they offer to the pharmacist is emergency medicine specialization. So it is an emergent role nowadays. Okay, so where we practice in the emergency medicine that is related to the toxicology, like pre-hospital care, and retrieval medicine, that is transporting the patients from one care to another care. Okay, so where a lot of transition work is to be done, especially errors will occur when once the patient is getting transmitted from one care to the another care, or from one facility to another facility. Okay, so there are a lot of chances of getting, like, the chances of occurring the errors. Okay, and these errors are nothing but they mainly occur in medication, that is the medication errors. Okay, so medications may not get charted properly. Okay, so here the pharmacist plays a main role or a major role here. So in the hospitals, when once the patients they get admitted in the emergency department, so nowadays in all the hospitals, there is a new role that is emerging, is the emergency pharmacist. Okay, so that is the pharmacist, they work in the emergency department. Okay, so the main role of this emergency department or the emergency pharmacist is they have the rights to chart the medications. Okay, so at first they will get all the medication history. Like the doctors, they won't have the time to get the medication history from the patients. Okay, so the pharmacists need to get the medication history from the patients, and then the pharmacists need to chart all the medications. We have a template. We need to enter all the medications in that. Okay, so we need to enter all the medications, and then we need to do the reconciliation. So we'll let the doctors know that, okay, these are the medications the patient is on before presented to the hospitals. Then the doctors will chart the medications, and again the pharmacists need to do the reconciliation. Okay, so by the main role of the pharmacist is, with a highly skilled pharmacist, can prevent a lot of errors. Okay, can prevent occurring a lot of errors. So it is also an emerging role in hospitals these days. Then the next one is the general medicine specialty. So it is the most important specialty. And for any hospital pharmacist, in case if your pharmacist need to become a specialized in one of the pathways, like in case if I'm interested in cardiology, and if you are interested in neurology, and if you want to become a neurology pharmacist, or if you want to become a infectious disease pharmacist or oncology pharmacist, so what will be the pharmacist it is? First, they need to do a rotation in general medicine. Okay, all the pharmacists at first they need to gain the knowledge in general medicine. So without practicing in the general medicine, they can't become a specialized pharmacist in Australia. Okay, so general medicine is the first and the core important one. So where we cover all the things, we not only cover any specialized ones. So we get the patients of cardiac problems related, neurology, gastro, rheumatology, immunology, endocrine, critical care, all the conditions will get covered under general medicine. Okay, but the only difference is we won't go in detail. Okay, so the things, that is the basic things which are required for treating the patient, will get covered up over in the general medicine. So the most important one, and the I can say that the high priority should be given for general medicine. So where we cover all the specializations. Okay, and in case if you want to practice as a hospital pharmacist, especially as a clinical pharmacist in Australia, so as I mentioned that at first you need to do a rotation in general medicine, then only you will become a specialized pharmacist in case if you are interested to go in any one of the specializations. And the other important thing is, all the hospitals in Australia, especially the regional hospitals, they don't have the specialized roles. Okay, they don't have the cardiology specialization, they don't have the neurology specialization, they don't have neonatal specializations. Okay, but all the hospitals, even if it is a very small remote area hospital, they need a general medicine specialized pharmacist. Okay, general medicine specialized in the sense the pharmacist should have an overall knowledge of all the conditions. Okay, so that's why always the general medicine, it plays a major role, and it is the first preference that we need to give. Okay, and from this general medicine, after doing the rotation in general medicine, then only we can try to improve, or we can try to towards the specializations. Okay, So that's the importance of general medicine. Then, then the next important one, it is also a most important one, is the geriatric medicine. Okay, so nowadays, like we know that, especially in countries like in Australia, the geriatric population is increasing. Okay, so in case if we have a specialization in geriatric, and if we become a geriatric specialized pharmacist, okay, so most of the big hospitals like Royal hospitals, okay, Royal Melbourne, Royal Adelaide, okay, all those hospitals, they have a specializations, okay, like geriatric specialized pharmacist. Okay, even Monash will have, even the hospital where I'm working, we got this specialization. Okay, so where we mainly focus, where the pharmacists will mainly focus on the geriatric care. And this geriatric medicine, it also plays not only a major role in hospitals, but also in community. Okay, so in community, how does it plays a major role is, in case if you become a consultant pharmacist, okay, if you go through the consultation pathway and if you become a consultant pharmacist, then the main role of the consultant pharmacist is to do the home medication reviews. Okay, and obviously we do the medication reviews only for the geriatric patients, because they will be on polypharmacy. Okay, so we never do the medication reviews for a patient who is 30 years age or 25 years age, because on 30 years or 25 years, they take only one tablet of Panadol. Okay, so no need of doing any medication reviews for them. But for all the geriatric patients, all the geriatric populations, so we must do the medication reviews. Okay, so specialization in geriatric pharmacist, okay, so is the most important one. So not only for hospitals, but also for community, because if you want to do the medication reviews, and for medication reviews, there will be two types. One is the home medication and the other one is the residential medication. So for these pathways, like how to become a consultant pharmacist, like all the pharmacists, they are not allowed to do the medication reviews in Australia. Only the consultant pharmacists are allowed to do the medication reviews. So I will explain in detail in a separate section. And also I'm going to conduct a webinar for all the Elite Expertise students. Okay, so where I will explain how to become a consultant pharmacist in Australia and how to go through all these pathways and try to secure a position in hospital as a clinical pharmacist. Okay, so that's it's a workshop. It's a one-day workshop. So that workshop, I'm going to plan it soon. Okay, so once everything gets ready, then I will let you know, guys. Okay, so remember, geriatric is also a most important one. Then the next most important one is infectious disease specialization. Okay, so infectious disease specialization, here the pharmacists, they become infectious ID specialized in critical care, tropical medicine, antimicrobial, like we do the antimicrobial stewardship, TDM monitoring for all the antimicrobial medications, then surgical prophylaxis for HIVs and for all the STDs. Okay, so where the pharmacist will become a specialized in all the infectious diseases. And this role, it plays a most important thing. And this role, that is the infectious disease pharmacist role, is not only important in big hospitals, but also in remote area, that is in the regional hospitals. Always they need a infectious disease pharmacist. ID pharmacist is always required, because the doctors, they always keep on asking the advice from the pharmacist. Okay? They keep on asking the advice from the pharmacist that what alternate that we need to use. Okay, or once they get the patient's sensitivity culture and sensitivity test, then immediately they will consult the pharmacist. Now, which antibiotic that we need to select. Okay, so always the pharmacist will play a major role in the hospital, especially in the Australian hospitals. The pharmacist will have a major role in case if they become ID specialist. Okay, so I recommend that this is the strongest pathway in case if you guys are planning to become a clinical pharmacist in the future in Australia. Okay, so what will be the pathways that I'm emphasizing? These pathways will have a, like they are, I can say that these pathways will give you a golden opportunity. Okay, because all the hospitals, they will have these specializations, like the previously that I mentioned is the general medicine. If you are specialized in general medicine, that is oral therapeutics, then even the regional or the remote hospitals also immediately they will take you in the job. And geriatric as well. Okay, after general medicine, geriatric medicine, it will have a very good scope. Okay, and infectious disease specialization as well. Okay, and even in the jobs like in Seek as well as in other websites, when you search for clinical pharmacist jobs in Australia, okay, so most of the jobs that they publish is what is the grade 2 general medicine pharmacist or grade 1 general medicine pharmacist, or they especially need the ID specialist pharmacist, okay, or geriatric specialization pharmacist. And rarely, like monthly, or I can say that for every 2 months, one post or one position will arise for cardiology specializations, okay, and for other specializations. But these are the hot cakes that I can say. If you are specialized in these pathways, then you can easily grab the clinical pharmacist job in Australia. Okay. Then moving on to the next specialization is the mental health specialty. It is also one of the, like I can say, it is also a hot cake, okay, mental health pharmacist, because nowadays a lot of young populations, they are having a lot of depression problems. Okay, so the mental health issues are increasing in Australia. Not only in Australia, like worldwide, I can say that these mental health problems are increasing. Okay, especially in Australia, these mental health problems for the last 1 decade, if we have a look through the graph is like going upward. Okay, a lot of new, especially young patients, they are having a lot of mental health problems. Depression is one of the most common one in Australia. Okay, so it means that if we are specialized in mental health, okay, then your scope, again, it will be higher. Okay, so not only if you become a specialized in mental health pharmacist, so your scope, it's not only in hospital sector, but also in community sector as well. So you will have a very good scope over there. So specialization in mental health, in the sense you will be dealing with depressions, and you will be dealing with bipolar, schizophrenia. So all those conditions, especially in all the hospitals, we also have a mental health unit, separate ward as well. So where we'll be dealing mostly with this mental health issue patients. Okay, so it is also I can say that it is also a booming opportunity, especially if you want to work as a clinical pharmacist in mental health specialization. Then moving on to the next one, nephrology specialization. So Australian hospital practice, it also allows the pharmacist to work as a specialized pharmacist in nephrology. Okay, but the scope is very less. Okay, so all the hospitals, like the big hospitals, Royal Hospitals, Monash, all the hospitals in Melbourne, okay, Northern Health, where I am working, all they have this nephrology specialized pharmacist role. Okay, but when it comes to the nephrology specialized pharmacist role, only 1 or 2 pharmacists will be required for that position. Okay, so it means that you won't get frequent opportunities to work in that role. Okay, but again, if you are a specialized, okay, and whenever the role it arises, and if you are one of the potential candidate in the interview, then definitely they will hire you for this role. Okay, then the next one, neurology. It is also an interesting thing, like interesting practice, clinical practice for the pharmacist. So where we'll deal a lot of the neurological conditions. So especially in the neurology specialization. So right now I'm working in the neurology department, in the neurology ward at the moment. So where I'll be dealing mainly with the Parkinson's patients. Epilepsy is the most important one, where we need to adjust the dose. So dose adjustment is much required for epileptic patients. Also, we'll be dealing with the dementia, that is the Alzheimer's disease problems, and all the other neurological problems like severe migraine issues, and all those patients, they will get admitted in the neurological ward or in the neurology ward. Okay, so neurology also, it will have a very good scope, but again, it is limited opportunities. So hardly they require only 1 or 2 pharmacists to work in this position or in this role. Okay, so you always the opportunities, it won't pop up. Okay, so in case if you become a neurology specialized pharmacist, then you need to wait until the opportunity comes. Okay, then only you can apply for the job. Okay, but again, if you get the chance and if you work in the neurology, then it is one of the interesting ward, and you will learn a lot in the neurology. Then the next one and the most important one, oncology and hematology specialization. Okay, always all over the world, they need chemo pharmacists, that is the oncology pharmacist. Okay, so the demand for oncology pharmacist, it will never end. Okay, so here there are 2 reasons why the demand for oncology pharmacists will never end. Is one is 80 to 90% they are not interested to work as an oncology pharmacist. Okay, so even if you give a opportunity to me and to work as an oncology pharmacist, I can say that I'm not much interested to work as a chemo pharmacist. Okay, because it depends on the interest. And the other thing is that most of them, they are scared to work in the chemo department because of exposure to all the chemo medications and those things. So that's why they just want to avoid it. Okay, but in case if you are well trained, and if you are expert in chemo, in handling the chemo meds, and if you become a oncology specialized pharmacist, okay, then your position, no one can compete with oncology pharmacist in Australia. Okay, so always there will be always the doors will be opened for oncology pharmacist. Okay, so the doors will never get closed for the chemo pharmacist or the oncology pharmacist. So the doors will always remain opened. If you are a specialized in oncology, then you can try, like in case if I can say that if in an year, if there are 2 positions that arise for the cardiology pharmacist in all the hospitals in Melbourne, okay, then for oncology or the chemo pharmacist, at least there will be 20 or 25 positions will come up. Okay, so that high craze will be there, that's high demand will be there for oncology pharmacist. Okay, so it is a very good opportunity. If you become a chemo pharmacist, the only thing is that you need to know how to handle the things. Okay, and one more thing is that in Australia, usually we won't do the preparations. All the technicians will do the preparations. So the chemo pharmacist or the oncology pharmacist, we need to check the charm pathways, that is the chemo pathways, and we need to adjust the dose, and we need to make sure the patient is receiving the correct treatment pathway. Okay, even I worked as a chemo pharmacist, that is the oncology pharmacist. Okay, in the previous hospital where I handled everything, but I never did the preparations. Okay, so that's the only thing. Like in case if you guys are interested, then it is one of the positions that gives a lot of pay as well. Like all the positions for chemo pharmacist, the positions that arise are grade 2 positions. Okay, not just the grade 1. Straight away they will give the grade 2 positions. Okay, so grade 2 year 3, grade 2 year 4, or sometimes if they need, then they will give you the grade 3 position as well. So in hospitals, in Australian hospitals, usually the positions, it will be in this way. Like at first they will give you the grade 1 for initial pharmacists, those who have 0 experience in hospital. Okay, so they will put you on the grade 1 position, and grade 1, that too they will give you year 1, grade 1 year 1. So you need to do 5 years to enter into grade 2. So grade 1 year 1, grade 1 year 2, grade 1 year 3, year 4, year 5, then you will enter into grade 2 position. Okay, again grade 2 year 1, year 2, year 3, year 4, year 5, then you will enter into grade 3 position. Okay, so in this way, slowly we need to jump from one grade to another grade in Australian hospitals. But especially for chemo pharmacists, straight away they will give you the grade 2 year 3 or year 4, or year 5, or even if you demand, they will give you grade 3 position as well, if you are a specialized and if you have experience in chemo as a chemo pharmacist or oncology pharmacist. Okay. Then the next one, pediatrics and neonatal specialty. So all the hospitals, especially the major hospitals in Australia, they have the role for pediatric pharmacist. Okay. So where the main thing is that dealing with the infants and the children's, where the dose adjustments and monitoring are the most important one that the pharmacist will do in this role. Okay, but all the major hospitals, they have the pediatric pharmacist specialization. Then next one, the pain management specialty. It is also one of the specialties where the pharmacist will be specialized in the pain management, especially the pharmacist, they need to know about all the opioids. Okay, how to adjust the dose of the opioids. Okay, so they will advise the doctors that based on the current dose of the patient, like if the patient is on the morphine, then from how to change from morphine to oxycodone, or from oxycodone if they want to change it to buprenorphine, from buprenorphine to fentanyl. So all those changes, okay, will be done by the pain management specialized pharmacist. Okay. And the next one is the palliative care. So palliative care is nothing but the pharmacists, those who work in the end of life, that is the palliative care settings. Okay, so most of the hospitals in Australia, they will have this palliative care specialization. Okay, so if you become a palliative care specialized pharmacist, then you can get into this role as well. Okay, then the next one is the respiratory specialization. If you become a respiratory specialized pharmacist, then you can work in the respiratory department. Okay, that is the respiratory ward, where the most patients that you cover are COPD patients, asthma patients, okay, and other respiratory issues, okay, pulmonary fibrosis and all those things. So it gets covered. But again, this role, it doesn't play it doesn't have much scope. Okay, only one pharmacist in one hospital would be sufficient to cover this respiratory specialization. Okay. Then the other specialties which are available in the hospitals in Australia are, so most of these specialties, I can say that they are not much of the clinical related specialties. Okay, so these are not the clinical specialties, especially this compounding pharmacist. Okay, so in hospitals as well as in community as well, we have the compounding pharmacist in Australia. So this compounding pharmacist, their main role is to do the compounding. Okay, for example, they can prepare the suspension for melatonin, so they can prepare the suspension for omeprazole. Okay, so these are the things that should be done by the compounding pharmacist. Okay, and dispensing pharmacist. So dispensing pharmacist is nothing but all the hospitals, they need a dispensing pharmacist. Okay, so without dispensary, the pharmacist, it can't run. Okay, the hospital, it can't run. So the setup will be in this way, like there will be a big main pharmacy where there will be at least 10 or 15 pharmacists will be there who will be doing this dispensing. The technicians will be doing the dispensing, and the pharmacists will be doing the checkings. Okay, and so on. And once the pharmacists do the checkings and everything is done, then this dispensing pharmacist, they will send the medications to the wards. Okay, where the ward pharmacist will take care of those medications. In the sense, ward pharmacist's role is only to screen the scripts or screen the charts, and then send the orders to dispensing pharmacist. Okay? But all the hospitals, they need the dispensing pharmacist role, because at least like in each hospital, I can say that at least they need 10 to 15 dispensing pharmacists. And this is the role, dispensing pharmacist role is the role that we can get, like if you are interested to enter into the hospitals, easily you can get this role. Okay, getting into a clinical pharmacist role is a bit difficult, but if you are interested and if you try, then you can easily get this dispensing role. Then the next one is the education pharmacist. So education pharmacists, they are the specialized pharmacists. Okay, they have a major role in, especially in big hospitals, where there will be a lot of training or the education will be going on, especially the hospitals like Monash. Okay, so where Ma'am Harita is doing, so she's an education pharmacist. So where they will teach all the new pharmacists. So whoever the newly appointed pharmacist. So for all the newly appointed pharmacists, the training will be provided by the education pharmacist. So education pharmacist, in the sense they should have all the clinical knowledge. Okay, so they must have the clinical knowledge. It means that they need to do the wards. Okay, already, like this role, the education pharmacist role, straight away they won't give to any one of the freshers. They won't give this role. So they will give the education pharmacist role only to experienced pharmacists. Okay, those who have already done this ward rounds in geriatric, as well as in general medicine and in other specializations as well. Okay, then they will give this education pharmacist roles. Okay. Then the next one is the drug info pharmacist. So in big hospitals, especially in Royal Melbourne, there will be a drug info center. So where the pharmacists, especially, they will be allocated to provide the information to all the healthcare professionals. So anyone can call them, the doctors from any corner of Australia, they can call them, and their responsibility is to provide the information to the doctors or to the pharmacists or to the nurses. Okay, so what will be the information that is related to the medication, then they will provide the information to them. And we also have got the clinical trials pharmacist. The pharmacist will be especially they are designed, or they are mainly assigned to work as a clinical trials, work in the clinical trials. Okay. And surgery and perioperative, sorry, I forgot to include this in the clinical roles that is in the earlier before. So pharmacist in Australia, that is in all the hospitals, okay, they will have the surgery, that is the surgical department pharmacist as well. It means that they also have a very good scope. Okay. And the last one is the women's and newborn health. All the hospitals, they will have maternity wards. Okay. So where the pharmacists, those who are specialized in this role, especially, I can say that females are much interested to become a specialized in women's and newborn health. Okay. So when once they become the specialized, then they can work in that wards as well. Okay. So these are the scopes of hospital pharmacist, and these are the opportunities that Australian hospitals, they provide to practice as a clinical pharmacist in Australia. Okay, so that's it, guys. And sorry, there is another important thing that I need to let you know. It is about the resident training program. So actually the SHPA, that is the Society of Hospital Pharmacists in Australia, it offers a resident training program in different specialties. Okay, so in case if the candidate is interested to become a resident in cardiology, or resident in neurology, or a resident in infectious disease, or any of the specializations, so at first they need to apply for expression of interest in the hospital where they are working. Okay, so at first they need to apply for the interest, then also they need to enroll with the SHPA. Okay, and SHPA will provide the funding for it. Okay, like all the hospitals, they don't have this resident training program. Okay, it is for 2 years residency in cardiology, okay, or 2 years residency in any one of the specializations. So all the hospitals, they won't have this resident training program, but major hospitals, okay, in Melbourne as well as in Sydney, okay, in Queensland, that is in Brisbane, all the hospitals, they do have this resident training program. Like they will place you in one of the specialized wards, like in cardiology, or any one of the things like in critical care or in emergency medicine. Okay, so if you are interested to do a residency in those things, then you need to show your interest, and then you need to apply for SHPA. So the other thing is that it is a highly competitive position, or it's a highly competitive program, because each hospitals will have only one resident pharmacist program, or one resident training program per year in cardiology department. Okay, it means that only one pharmacist can do a specialization or become a resident in cardiology. Okay, the same goes with the critical care, the same goes with the emergency medicine. Okay, so it will be a highly competitive one. But if we apply for that position, then SHPA will, we need to enroll with the SHPA, and SHPA will, it will sponsor. And when once SHPA sponsors, then we can work in the one of the specializations for 2 years, and after that you will become a resident, like you will become a fully specialized pharmacist in one of those specialties. Okay, so these are the things that I would like, I just I just want to share with you guys all the scope of the hospital pharmacist practice in Australia. Okay, so thank you so much, and in case if you have any questions, then you can ask me.
Hi, sir. I have filtered few questions.
Okay, yeah.
Which were already asked in the chat. So someone asked, does education pharmacist perform other duties as well as that of specialized pharmacist?
Yeah, education pharmacist means they need to have a versatile knowledge. Okay, it means that they need to have the clinical knowledge. Okay, so what they will do is, education pharmacist in the sense, they won't put the pharmacist in the education role. They also ask the pharmacist to go and cover the wards. Okay, so like in case if you are working 5 days a week, okay, so one day, like you will be doing the education pharmacist role for 3 or 4 days. Okay, but on one day, that is on Friday, let's assume that on every Friday, okay, so you need to go and cover the ward as well. It means that you will be having the clinical knowledge as well. Okay, so you will be doing the education, and at the same time you will be doing you will be learning everything. That is also you need to go through all those clinical aspects, and you need to improve yourself in the clinical role as well.
How many years you have to study to get any specialty?
How many years to study? Actually, these specialties are not the things that we need to study. Okay, so the most important thing, like what we need to do is, at first, in order to becoming a specialized pharmacist is like it is a I can say that it is a second level of dream. Okay, but the first level of the dream that we need to have is to enter into the hospitals. Okay, so at first we need to enter into one of the hospitals in Australian hospital practice. Okay, and try to practice in general medicine. Okay, it doesn't matter even if you want this, if you are getting a position in the hospitals, it doesn't matter even if it is a regional hospital, just need to go to the regional hospital. And in regional hospitals, obviously you won't have any specializations up over there. Okay, but if you work in the regional hospitals for 2 or 3 years, then what happens is, after working there and after gaining the experience in those hospitals, then you can try to apply for the opportunities in the big hospitals. Okay, then the big hospitals, if they give you the opportunity to work initially to work as in the general, okay, then again you need to work in the general for 1 year, 2 year, 3 years, or 4 years, it doesn't matter. Okay, but eventually, like if you keep on showing the interest, like if you are interested in becoming a cardiology specialized pharmacist, okay, and if you keep on doing the SHPA programs, SHPA will organize the workshops. Okay, so if you keep on doing the workshops, and if you keep on improving your knowledge, okay, in cardiology specialization, then definitely on one day you will get that, you will enter into that role. Okay, so no one can stop you. So one day definitely you will enter into that role. The only thing is that you should have a strong determination. Okay, and for that determination and to reach that goal, initially you need to do some sacrifice. The sacrifice is nothing but, if you are getting a opportunity to work in any one of the regional hospitals, so you need to go there, work there, gain at least 2 or 3 years of experience, and move to the big hospitals. And even if the big hospitals, if they are not offering you in cardiology specialization, it doesn't matter. If they are offering you in the general wards, okay, then take that opportunity, grab that opportunity, keep on working as in the general wards. Okay, work 1 year, 2 years, 3 years, and after that you need to show your interest. Like all the big hospitals, they will have at the end of the year, when they do the appraisal, okay, they will ask you what is your next goal, what is your next target? What is your next aim? Okay, so during that time, you need to tell them that, okay, I'm much interested in cardiology. Okay, and in cardiology, I have done a lot of workshops. I have done a lot of research as well. I have studied a lot in cardiology, and even I have done some publications in cardiology as well. So I have a vast knowledge, and even in my home country, I worked in a big hospital, like in Apollo or some hospital, where I had a chance to work in the cardiology ward for 2 years. So in case if you have that already, if you have that experience, okay, and if you can show that experience in your CV, then definitely they will give you a chance to work in the cardiology. Okay.
Yeah. So Taranveer wants to know, in order to work as a clinical pharmacist, do we need to do any further studies or some special course?
So actually, I can say that here in Australia, to be honest, like I can say that getting into a clinical pharmacist role is highly difficult. Okay, so they won't take any one of the pharmacists, especially those who are coming from overseas. Okay, so for overseas pharmacists, it's highly difficult to enter into the hospitals. Okay, so the only thing is that you should never give up. Okay, so you should never give up. Like I can share my experience. Okay, so I worked as a clinical pharmacist before coming into before entering into Australia. I had a vast knowledge, especially in I worked in a lot of hospitals up over there in my home country, as well as in Malaysia. I worked as a clinical lecturer, and then I have gone through like a lot of credentialings and so on. Okay, so but still I faced a lot of difficulties in getting a job in the hospitals in Australia. Okay, so initially I faced a lot of challenges. Okay, so that's why the pathway was highly difficult. I had to do some other things as well. So what I did was, as this pathway, like entering into or becoming a clinical pharmacist job is highly difficult. So what I did was, at first I became a consultant pharmacist. Okay, so for that I have spent 1 year of time and become a consultant pharmacist and become an accredited consultant pharmacist. Okay, so these are things like actually hospital pharmacists, like when they do the interview for the hospital pharmacist, they don't need this consultant pharmacist position. Like they won't ask if you are a consultant pharmacist or not. But in order to build my resume, okay, so in order to boost my resume, I become a consultant. It means that my resume will stand up. Okay, so if there are around 60 or 70 applications, okay, so of those 60 or 70 applications, my resume will stand up because I have clinical experience. My specialization is masters in hospital and clinical pharmacy, and also I did a lot of contribution. Especially I was involved in research activities as well. I did a lot of publications. I had a lot of publications. Okay, and they will also ask that have you done any mentoring, as well as have you trained the intern pharmacists before? Okay, that is also one of the most important things that they ask during the interviews. Okay, so because I worked in the previous hospitals where I worked, I have like trained a lot of interns, as well as I have educated a lot of junior pharmacists up over there. Okay, so all those things are the plus points. Okay, so always we must try to build our resume. Like I can say that, guys, don't get disappointed. Like when the first time when you apply for the hospital pharmacist role in Australia, okay, assume that you will never get that position. Okay, it's highly difficult. You will never get that position. Okay, but again, you need to apply. Your application will get rejected. Third time you need to apply, fourth time, fifth time, sixth time, seventh time, eighth time, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 19, 20, up to 50 times you need to keep on trying. Okay, so for 2 years I have tried, and one day the stone, it like exactly 20 hit the target. Okay, so that's what here, which is important, is we need to trying in the sense, not just with the same blank resume, like I worked as a community pharmacist, I worked as a retail pharmacist, give me a position in the hospital. So if it's such a type of the blank resumes, if you keep on sending even 1,000 times, there is no use. They will keep on rejecting your application. Okay, so they will keep on rejecting your application. So you need to show that you are one of the strong, or you are one of the potential candidates for this role. Okay, so for that you need to work hard. Okay, so, and as I mentioned that I'm going to conduct a workshop. Okay, so in that workshop I will explain in detail how you can build your CV. Okay, what things that you can do in order to become a clinical expert pharmacist in Australia. Okay. Okay, guys. Any further questions?
Yeah, so when is the best time to get enrolled in specialty training program?
So there is no any best time to enroll in the specialty training programs. So actually these specialty training programs, these are like, even if you get enrolled in this specialty training programs, there is no guarantee that you will get the job. Okay? So there is no assurance that you will get the job, even if you get enrolled in the specialty training programs. But if you are enrolled in the specialty training programs, and if you gain the knowledge, okay, again, one more important challenge here is when you face the interview for hospital pharmacist role, okay, that is especially for the clinical pharmacist role, and especially when you are facing the interview for the grade 2 position, okay, as a clinical pharmacist, okay, the interview will last for 45 to 50 minutes. It is not like simply they won't ask how are you, what is your interest, what is your expected salary, okay, such simple things they won't ask. They will give you the case studies, especially when you are applying for the major hospitals in Australia. So the interview will be in this way, like initially for the first 5 to 10 minutes, they will ask you all the general questions. Then after that, they will give you the case study. Okay, so you should able to solve that case. Okay, so if you can't answer the case, they will never take you. Okay, so they will never take you, even like you can say that I have worked for 20 years in hospitals in Singapore. I worked 20 years in hospitals in Dubai. Okay, I worked in multi-specialty hospitals. Okay? But even if you fail in answering the case, they will never hire you. Okay, so that is the most important thing. The most important thing is that your interview, you must succeed in the interview. So in the interview, they will ask all the general questions, and at the same time, they will also give you this case scenario. You must be able to solve that case scenario. Okay, so once you solve the case scenario, and once you answer all the other questions, okay, and if they are satisfied, okay, so here the other thing, the most important thing is that getting an invitation for interview. When you get the invitation for interview from any one of the hospitals, it means that you are up to, like, your success rate is up to 60%. Okay, you have gained up to 60% of success rate. All the candidates, those who apply for hospital clinical pharmacist roles, they never get the invitation to attend the interview. Okay, so if you are like, in order to get that invitation, the first thing is that we need to do a lot of homework on our CV, on our resume. Okay, so we need to build up our resume so that it should be much attractive, and the director of pharmacy in the hospital, when they look at your resume, they should think that, okay, among they will call for interview, like in case if there are 80 candidates who have applied, then they will filter. Okay, and they will call the interview, like they will call only 10 candidates to attend the interview. Okay, so you should be one of those 10 candidates. In order to be one of those 10 candidates, okay, so your resume should be strong enough. Okay, so you need to show that, you need to prove that you have a very good clinical experience, you have got a very good clinical knowledge. Okay, you have got a very good experience. Okay, and you have contributed a lot in the hospital setups before. Then only your resume will get picked up. Okay, so if your resume gets picked up, it means that, like in case if they out of 10, if they want to select 2 or 3 candidates, okay, it means that your probability is higher now. Okay, the chances of getting the job will be higher. But again, you need to face the interview. In the interview, you need to answer the questions, especially they will provide the case scenario. You need to solve the case, and also you need to answer all the questions that the interviewers, the panel, they ask. So usually in the panel, there will be 3 or 4 members. Okay, so everyone, they keep on asking the questions. So you need to answer all the questions. Okay, then if you are lucky enough, then you will get the opportunity.
Okay. So next question is, what is the availability of internship position in hospital pharmacy, or is it mandatory to do internship in community sector?
Yeah, I will let you know, guys. So getting a position in the hospital pharmacist as an intern, it's highly difficult, highly in the sense, highly impossible. Like I can say that it is 0.001%. Okay, so don't wait for that. Okay, trying for position as internship in the hospitals. Okay, so it is highly difficult. So the best way is do internship in the community pharmacy first. Okay, because only the community here, the main difference is, like in Australia, we have got only limited hospitals, only few hospitals are available. So all the hospitals, even the hospitals which are there, all the hospitals, they don't have the facility to provide the internship. Okay, so in order to offer an intern position in the hospital should be sponsored by SHPA. Okay, actually it should be sponsored by the SHPA. Then only those hospitals will get the chance to enroll the intern pharmacist. So all the hospitals in Australia, they don't have this SHPA funding for internship. Okay, so especially in the remote area or the regional hospitals, they don't have the funding. So it's highly difficult to get a position in the hospital. So my advice is to do an internship in the community first. Okay, and then based on your previous clinical knowledge, okay, as well as after doing your internship, while you are working as a pharmacist in pharmacist in community, still you guys need to keep on improving your clinical knowledge. Okay, and try to build your resume. Okay, and then try for hospital jobs. Okay, so even I did the same thing. Even initially, I tried for internship in the hospitals, but I was unsuccessful. So I did my internship in the community, but even the day when I enrolled in the community pharmacy as an intern, okay, so my trial every day, I was dreaming only about this hospital's position, like a clinical pharmacist position. Okay, so I tried to develop my resume. Okay, even it is not required like to do the research. Okay, but I was involved in research activities as well. Okay, because I need to show that my resume, it stands out of those 80 candidates or the 100 candidates, those who applied for that position. Okay, and especially in the hospitals, in Australian hospitals, they will ask about, do you have any research experience? Do you have any research knowledge experience? Okay, so this is one of the questions that they ask. Do you have any experience in training the interns? This is another question that they ask. Okay, so as I mentioned that in the workshop, I will explain everything in detail. Okay, so but finally, my advice is don't waste the time by trying to grab the intern position in the hospitals. So just when you get the intern position in the community, grab it, do your internship, finish your internship. After finishing your internship, then keep on trying for hospital positions.
So next question is, once we became pharmacists in Australia, we can only apply for clinical trials in hospital? Like she means like, can we apply for clinical trials in hospital?
Yeah, like clinical trials, I can say that there are a lot of companies which are here in Australia. Okay, so they will be doing a lot of clinical trials, and the thing is that these companies, they do the clinical trials in collaboration with the hospitals. Okay, so they do the clinical trials in collaboration with the hospitals. Okay, and all these companies, like say for instance, if it's the Pfizer, okay, so Pfizer will be running the clinical trials in Royal Melbourne Hospital, in Northern Health, and in all the hospitals Pfizer will be running, and AstraZeneca will be running. Okay, Ali Lilly will be running. Okay, so all the major companies, they will be running their clinical trials in the hospitals. So here, the thing is that they do need a clinical pharmacist. They want a clinical pharmacist to be one of the team members in clinical trials. Okay, so even clinical trials will have a very good scope, especially in India. If you have worked as in the CROs or for in any of the companies, okay, then if you become a pharmacist in Australia, okay, then you will have a very good scope to become a clinical trials pharmacist here. Okay, so the thing is that the pay rate for clinical trial pharmacists will be higher. Okay, but again here in clinical trials, as you guys know, that anyone can enter into this role. Okay, in the CRO positions or all those positions, anyone can enter. Just a BSc degree person can enter into this role. Okay, but remember that in those positions, there will be a specialized position which is known as a clinical trials pharmacist position. Okay, so all those BSc candidates, they can enter into other roles, but they can't take this clinical trial pharmacist position. Okay, so only the pharmacist can take the role of the pharmacist position. Okay? So if you are a registered pharmacist, at first, in order to grab that position, at first you need to become a registered pharmacist. Okay, so after becoming a registered pharmacist, okay, and if you work in any in the clinical trials for any one of the companies, then your pay rate will be higher. If you are not a registered pharmacist, even though if you are a PhD candidate, if you have done a PhD in Australia or any one of the countries, okay, and if you are working up over there, so your pay rate will be very low. Okay, just they will give hardly 80K per annum. Okay, but if you are a pharmacist, registered pharmacist, and if you are working in the clinical trials sector, that is the clinical trials pharmacist, then eventually your pay rate, like within 2 or 3 years, it will go up to 140K. Okay.
So here is one interesting question by Mahesh. If we want to become oncology and hematology specialty pharmacist, what type of risks of medicine exposure will be there?
So risk in the sense, like usually you won't get much exposed to those chemo meds. Okay, in Australian practice, in like especially in all the major hospitals, under a team, like usually there won't be only one oncology pharmacist won't be there. So there will be one team leader. Under the team leader, there will be 4 or 5 oncology pharmacists will be there. Okay, and under these 5 pharmacists, there will be 2 or 3 technicians. Okay, always the technicians will be there. So here, one of the main challenges is that we need to prepare the chemo meds. Okay, so usually the technicians, they will do the preparations. Okay, like transferring into the bags and so on, infliximab, extracting and transferring into the 1 liter of the bags and so on. So all those things, all those tasks will be done by the technicians. But remember, in case, like if technician is not available, or if the technician takes a sick leave, okay, then it's the pharmacist's job to do that. Okay, so pharmacists need to handle those things. If the technician is not available, then the pharmacists need to handle those things. But always the team leader will never handle those things. Okay, and the senior pharmacist also, they will never handle those things. Only the juniors who recently got appointed up over there, so they need to handle it only when the technicians are not available. So the main role, what we do is, even I worked as a chemo specialized. I'm not a chemo specialized, but as I work, the hospital where I worked before, okay, so we don't have the chemo specialization. Okay, it means that I have to do all in one role. Okay, so all in one roles. So I have to cover each and everything. I have to cover the emergency. I have to cover the acute. I have to cover the oncology. I have to cover pediatrics. I have to cover maternity and so on. Everything I have to cover there. Okay. So the thing is that I never handled all those chemo meds. I never touched them. Okay. Because what we used to do is we used to order through a third party. In Australia, we have a Slade. Slade will prepare all those things, and Slade will transport. Like every day in the morning, we will receive the stock from the Slade. Okay. So once we receive the stock, then my main job is I need to check the chemo pathways. I used to go through all the chemo pathways, and I used to check whether the chemo pathway, the doctor, that is the oncologist who have selected the pathway, whether it is appropriate or not. Okay. Whether the dose adjustment is required, if there is any dose adjustment is required based on the patient's current conditions, based on the patient's body weight, as well as based on the patient's other factors, like other factors in the sense, at first we need to check the neutrophils, how the neutrophil count is there, what is the patient's platelet count, what is the patient's hemoglobin, okay, what is the GFR value, how the hepatic function, what is the hepatic function of the patient. Okay. So everything that I used to screen, okay, and I used to cross check with the guidelines. So in Australia, we mainly follow the EVQ. EVQ will give all the important points, all the important guidelines, like if it is infliximab, what we need to do. Okay, so everything, how to monitor, how to adjust the dose, everything will be there in the EVQ. So CHARM will direct it to the EVQ. So from EVQ, I will cross-check everything, okay, and then I will release that order, okay. So here, the pharmacist will play a very major role, unless the pharmacist, if the pharmacist, they won't release that medication, the nurses, they can't administer it to the patient, okay. So in order to release that medication, we need to check everything. We need to check, go through all those things, okay. And when everything is correct, then only we need to sign, okay, and we need to release the order. Sign in the sense it is the digital signature in the CHARM. So once we enter our user name and the password, it means that that medication will be released. Then only the nurses, they can administer that medication to the patient, okay. So, but as I mentioned that sometimes, especially in few of the hospitals, you need to handle the chemo meds as well, okay. So that's the only risk that is involved. Otherwise, always the oncology pharmacist, in the sense it is the hot cake in Australia, not only in Australia, even if you go to US, UK, Canada, Dubai, Singapore, anywhere in the world, even in India, if you are a specialized in oncology specialized pharmacist, then you will straight away, you will get the grade 2 position, and you will be paid high for that role.
Okay, so the next question is, when I finish the internship, what kind of position in the hospital can I apply, considering that I don't have any experience?
Grade 1, year 1.
Okay, so apart from clinical pharmacy sector, is there any special opportunity in Australia for pharmacists with nanotechnology master's degree?
Nanotechnology master's degree, like those are the emerging roles, okay. So but I never came across those things, okay. But all those are the emerging roles. So right now, all those roles like will be only in some specialized sectors, okay, but not in all the areas, like not in all the hospitals you will find the opportunity to get a job if you are doing some specializations in such things.
Okay, so yeah, Meet, your question is answered by me. Okay, so what about working in a pharmaceutical company? Is it easier than working as a hospital pharmacist without any experience in that field?
In pharmaceutical companies, like again, like in pharmaceutical companies, it's a very good opportunity. Like even as you know that even in India or in other countries as well, like if you are working in the pharmaceutical companies, then you will get a very good pay, as well as you will get a very good promotions and so on, okay. So like pay wise, the pharmaceutical companies, they will pay you a lot. Okay. Like if you get like 10 years of experience, then you can expect up to 160K in pharmaceutical companies. Okay. But again, the challenge here is you won't get the job, like in case if you are planning to migrate to Australia as an industrial pharmacist, then the opportunities will be very less. The opportunities will be very narrow. Okay. So the PR process, it's highly difficult for the industrial pharmacist. Okay? But if you become a pharmacist, like a licensed pharmacist, registered pharmacist, okay? And then if you can try, when you become a registered pharmacist, in the sense you will have your permanent residency in Australia. So, and if you have the permanent residency, and if you are a licensed pharmacist, then if you can try in the industries, then you will have a very good opportunities. Like industries will have a very good scope, and even if you work in the industries, like the further growth will be higher. But again, Australia, we don't have, here in Australia, there is no production. Okay, so all the things is that they will import from other countries, like from India and all the other countries. Okay.
So
The scope
Dilshad
will be,
asked,
yeah, the scope for like in case if you are much interested, like in production, in the sense like there is no scope, but R&D, there will be always research will be going on. And if you have any sort of experience up over there in R&D, and or if you have experience as in the analysis, okay, so in the quality QA and QC, then you may you will get the chance of working up over in Australian industries.
yeah. So Dilshad asked two questions. Dilshad, your first question is already answered by sir, and the next one is, what are important points we should be keeping in mind while searching for internship?
While searching for internship, like I will let you know, guys, like in the workshop, as I mentioned that I'm going to conduct a workshop for all the elite students. Okay, so where I will explain you how you need to prepare your resume and what are the expectations that what things that they expect from you and what type of answers that you need to give. Okay, so everything that I will train you. Okay, so don't worry, in the workshop session, I will explain everything for you.
Okay, sir. So Carol asked the question, is the salary higher in community or hospital pharmacy?
Obviously, for hospital, the salary will be higher. Okay, especially if your grade is increasing from grade 1 to grade 2, grade 2 to grade 3, grade 3 to grade 4. Okay, so your pay rate will keep on increasing. Okay, because all the hospitals, they are the public hospitals. Public hospitals, in the sense, the government will pay the salary. Okay, so they won't try to negotiate much. Especially, they need a specialized pharmacist. So they need a potential candidate. So they won't try to negotiate much in hospitals. Okay, so if you demand, if you are worthful, and if you demand, then they will give you a higher grade. The higher grade, in the sense, high salary. Okay, so obviously, if you are in the hospital pathway, the salary will be higher. But even in community, if you're still working as a community pharmacist, there is another way that you will earn a lot. I will explain you everything in the workshop. Okay.
Okay. So there are few questions which we missed. These were asked in the first part of the session. So one question is, how do you manage with people that come to you and compare you with the medical doctor?
Okay. So when they compare with the medical doctor, obviously the doctors are doctors, we are just pharmacists. Okay. But we have a very good knowledge in medications. Okay. So as you can see that the way that we have been teaching you. Okay. So we have been practicing as a pharmacist in Australia for the last 6 years. And we have been teaching you all the students at Elite Expertise. Okay. So you can see that the difference in the knowledge, and I can say that I gained all this knowledge only after coming and practicing here in Australia. Earlier, I had the knowledge, but the only thing that I had was mostly of the textbook knowledge. Okay, I haven't had much of the clinical exposures, okay, like the practice oriented things, okay, when I was working as a lecturer in the universities. Okay, but after coming here and after gaining after practicing here, so we have gained a lot of knowledge. Okay, and especially I can say that our knowledge, the pharmacist knowledge in medications, okay, so we try to find there were a lot of instances, like we always do, especially in the hospitals. I can say that like we will do at least 30 or 40 interventions every day. Okay, every day 30 or 40 interventions. Just in one single ward, we will do 30 or 40 interventions. And that too, all those interventions are the major medication errors that the doctors, they chart. Okay, so all they are the major errors. Okay, so it means that without pharmacist, okay, if only the doctors, they keep on prescribing and giving the medications to the patients, then there are a lot of chances of the medication errors, and there were a lot of cases where the patients, they got the wrong dose or a higher dose, okay, and got readmitted in the hospitals. Okay, so I can say that pharmacist knowledge, especially, we don't have any knowledge in diagnosing the condition and so on, but we have a very good knowledge in selecting the medication. Okay, so selecting the appropriate drug and selecting the appropriate dose for any particular condition. Okay, so we have the very good knowledge in selecting all those things. And all the doctors here in Australia, especially in hospitals, they really they appreciate a lot to the pharmacist. Okay, so they appreciate a lot to the pharmacist because we are providing a lot of support to the doctors in selecting the therapy. Okay, so I can say that we do have a very good knowledge, like in our specialty, in the medication knowledge, we do have very good knowledge, but again, we can't compare with the doctors.
So the next question is, what advice can you give us in choosing a pharmacy where to do the internship? Which pharmacies give the most opportunities for growth?
So the internship, in the sense, like, again, if you are overseas, okay, if you are coming from overseas, okay, it doesn't matter. Like getting an internship position is one of the great things, but nowadays it is not a big challenge. Okay, so if you try, definitely, if you have the PR, okay, and if you try, definitely you will get the internship position. It hardly takes 1 month time, that is 30 days. Okay, so within 30 days you will get the internship position in any one of the pharmacies in Australia. Okay, so let's say, for example, if you choose Victoria State, okay, and after landing here in Australia, if you are coming to the Victoria State and if you apply for the internship positions in Victoria, hardly within 30 days you will get the position, like pharmacist intern position in offer letter from any one of the pharmacies. So getting the position is not a big deal. Okay, but whatever be the pharmacy that they are offering you the internship, okay, so just do the internship, try to finish the internship. Okay, don't care whether it is the Chemist Warehouse or if it is any other pharmacy. My Chemist brands are all, they are the Chemist Warehouse ones. Okay, so it doesn't matter wherever you do the internship, just try to finish the 1 year of the internship program. Okay, and after finishing the internship program, then you will become a completely or the fully licensed pharmacist. Then you will have your own choice. Then if you want, you can still continue working in that pharmacy, or if you want, you can go and work in some other pharmacies.
Okay. So yeah, sir, that's it.
Okay, then.
So
Okay, guys. Thank you so much. Thanks for attending this session. Okay. And also, as I mentioned, that I will keep on conducting a lot of informative sessions, especially regarding the scopes, and also the other things like how to find the internship positions, okay, how to face the interviews. Okay, and as I mentioned, that I'm going to conduct a workshop especially in how to prepare in that workshop, I will explain you a few important tips like how to prepare the resume and how to face the interview, okay, and what are the main questions that they ask in the interview and what the interview panel they expect from you. Okay, so all these trainings that I will give you in the workshop, and also I will keep on continuing conducting such a type of webinars and other information sessions eventually. Okay, so once again, I would like to thank everyone for attending this session, and thank you, and I will see you again in the next session. Okay.